Welcome to Financially Speaking, brought to you by Buska Retirement Solutions and its affiliate firms. We offer retirement, tax, and legacy planning from a dedicated family-built team. Today we're taking a closer look at the Social Security Fairness Act and the connection between financial wellness and mental health. And now for our weekly question and answer segment.
Welcome back to Financially Speaking. Today I'm joined by Ryan Connor and Ryan Pekka of Buska Retirement Solutions and Buska Wealth Management. And in this segment, we're taking a closer look at the Social Security Fairness Act and what it could mean for retirees impacted by two provisions, the Windfall Elimination Provision, or WEP, and the Government Pension Offset, or GPO. What exactly is the Social Security Fairness Act, and how does it aim to address the WEP?
Sure. So the Social Security Fairness Act eliminates both of those provisions. Essentially, those provisions said if you worked for a government agency that you contributed to a pension that didn't require you to pay Social Security, it reduced your benefit if you qualified for it through other means. So whether it's spousal benefits or if you had a job prior to that you did pay into it. So what this act does is it says those rules no longer apply to you. It really applies to typically firefighters, teachers, policemen, and then people who worked and had overseas pensions. So think federally employed, workers that maybe didn't work in the U.S. based. Those people had their benefits reduced by up to 50% of that pension, which sometimes eliminated their entire benefit. It also eliminated any access to spousal benefits. That no longer applies to those people anymore with the Fairness Act.
And is that effective right now?
Yes. Yes, it actually became effective at the beginning of last year, so it's going to be retro dated. So anyone who should have received benefits basically during the interim period here will actually be receiving some back pay for those benefits as well.
Okay, and who will be most affected in a positive manner?
Yes.
That sounds negative, but
yes. So the impacts here are positive. So no one is necessarily having their benefit reduced by this. It's simply workers will be having benefits coming to them. So like Ryan talked about, this is mostly going to impact like firefighters, some public school teachers. The big one is going to be federal employees, though, since their particular pension program. A lot of the members of that program, like you talked about, you don't pay Social Security tax on those pension contributions. So especially if you were a federal employee who worked overseas, this is going to be like ambassadors' offices, diplomats' offices. Sure. So not even just the people that are actually in those official roles, but all of their support staff, which is a much larger group of people. That is going to apply to them. And they should see an increase in benefits because of that, and also some additional qualifications for spousal benefits, things like that nature.
And how could this Social Security Fairness Act change the way that Social Security is calculated for those certain workers?
Sure. So right now, like I said before, it reduced that benefit by up to 50%. So that is no longer in place. Really what that means, it's going to be about an average of $360 per month is what they calculated, up to $1,000 or more for certain individuals. So it's a pretty big impact when you're looking at the overall financial plan for these type of individuals. Yeah. And again, when you're talking about $360 a month, that's quite a big chunk of money that you're looking at there. So it could have a big impact for these individuals.
And again, a benefit for them.
Correct.
A lot of times we're talking about impacts that are not so beneficial. People make mistakes, but this is a good one for some people.
Exactly.
Should people who may be affected by WEP or GPO save differently or treat retirement saving different?
Yeah, so from a retirement savings perspective, this is going to be most impactful in the short term for a lot of those employees who have already retired and kind of will be getting a little bit of reimbursement kind of up front for benefits that they, retroactively should have received. But also going forward for them to sit down and actually plan out, how does this impact me? Because like we talked about, the average is projected to be about $360 a month per, qualifying participant, but the impacts may be significantly higher for some folks. Talked about as much as over $1,000 a month. Well, if you're having changes to kind of your fixed, your guaranteed income of $1,000 a month, that's going to have pretty significant short-term implications to what your retirement income situation should look like. So if you're an individual that is taking withdrawals from, an IRA or a 401k or, whatever savings tools that you've utilized, and all of a sudden your fixed income is going to increase by, at least a few $100 a month perhaps even higher, you probably want to make adjustments to the income that you're taking elsewhere. That way, so you're not potentially overdrawing. So this can create a situation where this, added benefit can either extend out a retirement for someone who's currently retired, or it can increase the amount of funds that you're getting month to month. If you keep your withdrawals the same, but all of a sudden you've got more money, well, congratulations, you've got more cash flow, and then that's a pretty good problem to have. And there are also going to be impacts as well for folks who are working in these particular industries who are not yet retired. Because what we used to have to do when we were planning for these folks is have to figure out, how much of their Social Security, their kind of, from looking at their income, how much of their projected Social Security they were really going to get because of these different provisions. Well, now that those are eliminated, they're also going to see a material increase in their fixed income between their pension and their Social Security. So when you go from a long-term planning perspective, now what we need to consider is, okay, how much do you need to save, or can we potentially move retirement dates up earlier because you don't necessarily have to save as much money in whether it's their 401k or their TSP is quite common amongst federal employees. And so perhaps instead of retiring maybe at 65 or 66, maybe we're backing it all the way up to 62 once they qualify for Social Security to be able to retire.
So you're first figuring out with your pension and Social Security or whatever, what is your basic income that's coming in? Is that how that works?
Yep.
How do you show somebody? I mean, I'm a little older than my wife is. I know you're going to say hard to believe, but I am. I have, my Social Security starting at X. Hers starts at Y. My pension kicks in at Z. How do you put that together for someone to understand that?
Sure. So we typically run a report. We call it the Compass report here. It's really your roadmap. So what we do is we plug all of those variables in and kind of project that out into the future for you, really show you what your future looks like in that circumstance or that case. We can play with those numbers a little bit, kind of change things around, see, hey, maybe you can't meet that initial goal you had set, or maybe, hey, you've got more money and we can adjust that higher. So it kind of goes case by case. In this case, we could maybe go back, readjust it to a higher income level for them each year and kind of show them, hey, your situation's changed pretty drastically between now and the last time we've met.
That would help. Remind me to give you a call. After a timeout, we'll consider how this act could reshape retirement income for public servants, educators, and others, and what proactive steps you can take to stay informed and prepared. Be right back.
Do you have a plan for how your assets will be handled after you're gone? Without one, the state could end up making life's most important decisions for your family. Through our partnership with the State Guru, we make a estate planning process simple and affordable, offering wills, powers of attorney, and revocable trusts. On average, our service costs 70% less than the traditional estate attorney fees, and you may even qualify for free financial and healthcare power of attorneys. Call our office today to get started.
And now back to our weekly question and answer segment.
Welcome back to our segment about the Social Security Fairness Act and how it may impact retirement planning for millions of Americans. Before the break, Ryan and Ryan helped clarify who this legislation impacts and why it matters. Now let's explore what retirees and those nearing retirement can do if they are affected. What kinds of retirement planning adjustments should be considered if WEP or GPO is in play?
Sure. So right now that they're eliminated, the biggest thing is kind of touching base with that advisor you already have, or maybe going to an advisor and talking to them about how this may change. You may not have applied for Social Security because it was eliminated. You may be getting a reduced benefit and be unaware of what next steps. So the first thing you do is just see if you're receiving benefits. If you are, your information is up to date with the Social Security Administration, there's nothing you have to do. It's going to take some time for individuals. They're working through that process. Social Security is a little bit behind in this. They say it may take up to a year. Typically with the government, that could mean longer. It's hopefully not, and especially because they're going retroactive with it. So it got enacted in January 5th of 2025, and then it goes retroactive to January 1st, 2024. So not only do they have to adjust benefits moving forward, they have to pay all those retroactive benefits, which it takes some time, and they're a little bit understaffed. So it's going to take them a little bit of time to kind of get to that point to start with. But in the meantime, you might want to meet with your advisor to adjust income planning, make sure you're on pace. For some individuals, this will put them over certain thresholds for the Affordable Care Act or possibly Medicare as well. So making sure that you're understanding kind of those tax consequences as well for you. And then it may also open some new opportunities. If you don't need that income, you've adjusted your lifestyle to where you're at now, and now you're getting a bonus of $360 a month, you may have some investment opportunities that you didn't have before that allow you either to maybe achieve that lifelong goal you've had, take a trip, do something you weren't necessarily planning to do before you had that income coming into you.
So you don't actually have to do anything. They'll just put that in the check?
That's correct.
One day you wake up, you got a raise in retirement?
That's correct.
That's pretty
There are
cool.
worse ways to live.
Definitely. How can someone find out if their pension or career history puts them at risk for things like this?
So the best thing to do is to actually just contact the Social Security Administration to figure this out. Now, like Ryan talked about, in order for them to initiate those different payouts, they're actually having to go in and calculate all of these manually. And so that is why the process is not happening overnight. But to see if you are going to qualify, your best thing to do is to contact the Social Security Administration, and hopefully a representative will be able to go through your work history and see if it applies. Especially if you worked, different jobs. Maybe you didn't work for the federal government the entire time, or didn't work as a firefighter the entire time. The effects are going to be different and kind of distorted depending on how long you were in, one of the programs that was impacted by WEP. And so, contacting the SSA to get that figured out. How much that impact is projected to be for you is going to be kind of the first step in seeing, what changes need to be then made on the planning side as far as, are we just going to bank the extra income? Do we have to worry about things to our health insurance like Ryan talked about? If you're under 65, likely through the Affordable Care Act. If you're over 65, does this extra income impact your Medicare plan? In any way? Are you having to worry about, your Part B premium perhaps increasing because of that extra income? So contacting Social Security, trying to get an idea about if that's going to impact you, and if so, how much. And then kind of getting back and working with your financial planning team to kind of draft up a plan for this new era for you with a little bit higher fixed income.
Do with my newfound wealth, huh?
Exactly.
Nice. Are there any advocacy efforts or timelines people should be aware of?
Sure. So like I said before, it could take up to a year. Social Security is in a hiring freeze. They actually have less staff than they did in 2023. So that's another problem that they're facing, is not only does this take a lot of time to do, but they're short-staffed already. There's changes coming to Social Security. So I wouldn't necessarily say there's advocacy. There was obviously a lot of advocacy to reverse these laws. They were enacted in the 70s and 80s, where obviously economic conditions were quite different. Typically federal employees, you could live off pensions.
Right.
You could typically live pretty well off Social Security, maybe not well, but enough. So things have definitely changed since then, and this law was really designed to kind of change that back so that it's a little bit more fair, as they said. You've contributed to Social Security, you should be getting out of that. The other issues with this is they didn't really put any provisions to say where this funding is coming from. So they're still working through all of those things. Obviously, when you're paying someone, this affects up to 3.2 million people, so about 1% of the population. When you're talking about giving them a pay increase of this size, but there's no funding behind it, they have to work through all of that as well. So making sure that, when these payouts come, where is that money coming from? How does that impact the rest of the program? And right now, that's kind of the biggest thing they're working to figure out, as well as addressing these on an individual basis. The database they have is quite large. Going through that one by one is probably pretty time consuming. Yeah, they might be, wouldn't surprise me. Hopefully it's not. And again, so really the biggest thing is kind of the patience at this point. Obviously, this has impacted you for a long time. Hopefully they resolve it quickly. But like I said before, they're expecting this to take up to a year, and it could potentially take even longer than that.
I guess it's a good thing you didn't know was coming anyway. So
that's correct, right.
How can working with a financial services professional help someone factor in WEP and GPO when building the retirement income strategy?
Yeah, so these impacts, especially for folks who are not yet retired, the impacts here are almost less known, because if you're already retired and you've already got your income kind of set up, this is basically going to be a bonus. You'll have to make some adjustments, to your income, maybe take less from your savings, but it's kind of an added bonus. For folks who have been planning for retirement now for a while and still perhaps have a little bit ways to go, this really does change the landscape for them in a pretty dramatic way. Because if you're looking at an increase to your fixed income of a few $100s or more, that means that in order to retire on the timeline you initially wanted, you probably actually need less savings to accomplish that objective. or it could allow you to retire earlier. So once you know what your impacts are going to be, once Social Security has been able to go through, been able to provide you with your updated information, that's where sitting down with a financial services professional would be really useful to see, how your plan has changed. Maybe you were planning on retiring in 10 years, but maybe now because of this alteration, maybe you can retire in 6 or 7 years with the same level of financial stability. Maybe all of a sudden, your timeline doesn't change, but all of a sudden I'm looking at an additional $400, $500 a month in terms of income.
Do you get more people who say, I want to retire at age X, tell me what my income will be, because I'm hanging her up, or I need income X, tell me what my retirement age will be? Which do you see more of? Just out of curiosity.
It very much depends on clients. Usually, a lot of times when folks are coming in, they're like, I would like to retire as soon as possible.
Okay.
And I always call it, what is a reasonable retirement date for you?
Okay.
Because you can hang them up whenever. Whether that's going to be a financially stable decision is a very different matter.
It's true.
And so the way that we try and run that Compass report that we've talked about a lot in terms of comprehensive income planning is, when is going to be the earliest reasonable retirement date for you? And of course, if a client wants to work beyond that, we can make adjustments for them knowing that, hey, maybe I plan on retiring in 7 years, you could retire in 4, and in year 5, they're kind of like, you know what? I think I actually do want to retire. They can know that they are, ready to go and in a good situation.
Very good, very good. Well, thank you guys. I know that's a deep discussion on WEP and GPO. It affects 1% of people, but for those people, it sounds like it's a pretty good thing.
Yeah, it's a big
If
deal.
you have any questions, certainly call Buska Retirement Solutions. Otherwise, we'll be right back with more Financially Speaking. Thank you, Ryan and Ryan, for joining us today.
Thank you.
If you're 59 and a half or have recently changed jobs, now might be the perfect time to consider a 401k rollover. Rolling over your old 401ks could simplify your finances and give you more control from investment options and costs to how and when you make withdrawals. A rollover could give you the opportunity to partner with a financial services professional and tailor your investments to your specific needs, not the company's group plan. Call our office today to schedule your complimentary consultation and see if a 401k rollover is right for you.
And now our Financially Speaking weekly desk segment.
Welcome back to Financially Speaking. I'm Cole Bruner from Buska Retirement Solutions and Buska Wealth Management, and joining me is my sister Kaylee Berenson. Now today we're diving into the connection between financial wellness and mental health, something that impacts just about everyone at some point in their life.
That's right, Cole. And we'll be referencing 2 powerful articles today, one from Columbia University Irving Medical Center and another from Amaranth Bank. They both outline how financial health goes hand in hand with mental and even physical well-being.
Before we get into the details, a quick note for our viewers. While both Kaylee and I are seasoned financial services professionals, today's conversation is less about numbers and more about how money stress, or the lack of it, can affect your quality of life. For the purposes of this conversation, I'll be taking the role of the curious listener, and Kaylee will offer some expert insights.
Thanks, Cole. That's a helpful way to frame it. Let's start by defining the concept of financial wellness. It's more than just having a certain income. It's about feeling in control of your money and being able to handle financial shocks and having a plan for both short and long-term goals.
And according to Columbia's article, being financially well can actually lead to a longer, healthier life?
Exactly. Columbia's professor Peter Munich states that even an extra $5,000 per year can have measurable impacts on both your health and longevity. And that's because financial wellness reduces stress, frees up time for healthy activities like exercise, and it makes it easier to afford better food and healthcare.
So having financial breathing room lets you make better life choices?
Absolutely. Think about it. If you're not stretched thin financially, you may not need to take on a second job or overtime hours, and that opens up time for rest, family, and self-care, all of which are essential to your mental and your physical health.
That makes a lot of sense. The Amaranth Bank article mentioned how mental health and financial health are tightly linked. Can you explain that a bit more?
Sure. So it's a two-way street. Poor mental health like depression and anxiety can lead to poor financial choices. And think missed bills, impulse spending, or neglecting long-term planning. And on the flip side, financial stress can cause or worsen those very mental health conditions.
Almost like a vicious cycle.
Exactly. And one of the Columbia researchers, Oscar Jimenez Solomon, put it well. He said that debt in particular can lead to feelings of hopelessness and shame, 2 of the most damaging emotions when it comes to your mental well-being.
And those feelings can lead to people to isolate themselves or avoid seeking help, right?
Right. And here's the good news though. Both articles do emphasize that having a financial plan, even a simple one, can help break that cycle. It can help create a budget or setting goals, and then also just knowing the path forward can help restore that hope and boost your motivation.
So even just writing down a plan can make a difference?
Exactly. It can. Jimenez Solomon says that hope increases when people feel that they have concrete pathways to reach their goals. And that's where financial counselors and planners or even just supportive friends can come in. They can help you build that path.
So that reminds me, didn't both articles recommend seeking help as a critical step?
They did. Columbia recommends free services such as the NYC Financial Empowerment Centers, and Amaranth advises reaching out to financial advisors or therapists. The message is clear. You don't have to go at it alone.
I love that. I like to think of us as providing essential support to our clients. Now, let's get more specific. What are some practical steps that someone could take to boost their financial wellness today?
Well, I'm glad that you asked. Here are a few key strategies that the Amaranth article suggests. 1, tracking your spending. Awareness is crucial. Number 2, create a budget and make sure that you're focusing on the essentials and your priorities. Number 3, set your financial goals. Even small ones can help you stay motivated. Number 4, invest in yourself. That could mean continuing education or learning a new skill. Number 5, you want to practice mindful spending. Ask yourself, does this align with my goals? Number 6, reduce debt. Start with high interest balances and seek help if you need it. And lastly, number 7, seek financial guidance. A planner can help you provide structure and also accountability.
That list is so actionable, and it really seems like our viewers can initiate many of these strategies without a big financial investment.
Great point, Cole. And this is about behavior, it's not about bank balances. You want to remember, just taking any step, no matter how small, it can improve your mental health.
Absolutely. Now, the Amaranth article also touched on addictions, like gambling, for example. That's a tough topic.
It is, but it is important. If somebody's overspending or they're stuck in harmful habits like gambling, the first step is that you acknowledge the problem and you want to seek help for it. Support groups, therapy, and even financial rehab programs exist. There's no shame in asking for help.
It's really encouraging to hear that recovery is possible for these people. So for people who are financially overwhelmed, what would you say is the first thing that they should do?
Well, 2 things. First, you want to talk to somebody that you trust. Shame thrives in silence. And number 2, build a mini plan, even if it's just writing down your top 3 expenses and then thinking about where you can make a change. That way you're building that momentum.
And for people who are doing okay but want to level up their financial health, what about them?
Well, great question. Columbia suggests maximizing your employer-sponsored retirement plan and using a health savings account, or an HSA if you qualify. Those tax benefits, they do add up over time, especially for younger workers.
Sure, yeah. And investing early can really change your financial future, right?
Absolutely. So Munich says that employees who start saving in their 20s can up with millions by retirement. And here's what's interesting. People who take these financial steps tend to experience less stress, they have better health, and they even live longer lives.
Okay, that's incredible. Being financially well isn't just about wealth, it's about wellness, right?
That's the big takeaway. So whether it's reducing debt, creating a budget, or simply talking to somebody about your financial stress, you're improving your mental health at the same time.
One last question, Kaylee. What would you say to someone who feels it's too late to change their financial future?
Well, it's never too late. That's one of the most empowering truths. Small steps today can really lead to meaningful change in the future, financially, emotionally, and physically. So start where you are and then build from there.
That's a powerful message. If you're watching this today and feel overwhelmed by your financial situation or just want to take the next step, reach out. Help is available.
Absolutely, Cole. And it looks like we have a few minutes left. So is there anything else that we should cover in this segment?
Well, since we're talking about mental health, let's revisit an idea that was big on the public radio circuit a while back. The idea that $75,000 per year is the income level at which happiness plateaus. Do you remember that?
I do. And it's an interesting idea. And definitely your mileage may vary, sort of type thing.
Sure. Yeah, absolutely. I agree. A NASDAQ.com article titled Money and Happiness, Does the $75,000 Rule Still Apply? Covered this particular topic. It said in the 2010 2010s, researchers found that when people reached $75,000 per year, they were happy because they had enough to cover their expenses and had enough left over to still enjoy life.
And does that claim hold up? Does happiness really flatten out at $75,000 per year?
Well, this is where it gets interesting. A new study pinged people throughout the day to measure their happiness in a given moment. Over time, these pings added up to millions of data points that measure happiness day by day and minute by minute. And the result was that there was no happiness plateau relative to income.
Well, that is fascinating. And how did they gather data for this original study? The one that came up with the $75,000 plateau?
Well, the original study used self-reported information from surveys.
Okay, well, it sounds like the second study was highly innovative.
It was, definitely.
Cole, what does that mean for our viewers? Does money really buy happiness?
Well, according to the NASDAQ.com article, it can, but perhaps for different reasons than we might think. Money buys happiness when you have all of your basics covered and you have financial room for experiences like travel or concerts or season tickets to your local theater.
Well, money buys happiness when you use it for the right reasons, like experiences, but not status symbols, right?
I think that's right on the money. And now, really, we are out of time at this point. So viewers, if you have questions about money, mental health, and happiness, you can contact us today at retirewithbuska.com or call us at 715-355-4445. We're always here to help.
We'll be right back with more Financially Speaking right after this.
You've likely heard about the new tax bill, but do you really know what it means for you? It changes how overtime and tips are taxed, makes several tax cuts permanent, and introduces a new deduction for those 65 and older. With updates like these, now is a great time to revisit your financial strategy. I'm Cole Bruner from Buska Retirement Solutions. Let's talk about how these changes could affect you and what steps you can take. Call us at 715-355-4445 to schedule your complimentary consultation.
Thank you for tuning into this week's edition of Financially Speaking. We're glad that you were able to join us today, and we hope that you learned some useful retirement tips along the way.
On today's show, we covered a number of important topics, and hopefully we did so in a manner that was easy for you to understand. Now remember, this is the same way that we communicate to our clients when we meet with them in person. Remember, with the help of the right financial services professional, you can create a quality retirement, and our team is here to help. Right now may be a great time to get a second opinion on your current retirement plan. So call us at 715-355-4445 or go to retirewithbuska.com to continue your retirement education, catch up on some previous episodes of our TV and radio show, or schedule your complimentary, no-obligation consultation.
If you have any questions or comments about today's show, call us at 715-355-4445 or feel free to send us an email at info@retirewithbuska.com. Join us next week at the same time and the same place for another episode of Financially Speaking.